Welcome to Pharmacology case studies. Now we are going to study about topic anesthetics. The first case study is regarding levels of sedation, which one applies to loss of perception and sensation to painful stimuli. Both of them are lost. The correct option is B, general anesthesia, because anxiolysis is just a state of relaxation, whereas this moderate sedation, it just maintains with adequate airway and respiratory competency. And deep sedation has some response to stimuli, but respirations may be inadequate. General anesthesia is the only which gives a total loss of perception and sensation to stimuli. Next, which of the following decreases minimum alveolar concentration? The correct option is C, pregnancy, because only in pregnancy minimum alveolar concentration is decreased, or the rest increases it. Next, which of the following determines the speed of recovery from IV anesthetics used for induction? The first is when you are inducing. So which will determine liver metabolism, protein binding, ionization, or redistribution of drug from sites in the CNS? So for induction we need CNS. Option D is correct. Following the initial flooding of the CNS with non-ionized molecules, the drug will diffuse to other tissues. With secondary tissue uptake, the plasma concentration will fall and allowing the drug to diffuse out of the CNS. Initial redistribution into the other tissues will lead to the rapid recovery seen after a single dose of an IV induction drug. Protein binding, ionization, and lipid solubility, they all affect the rate of transfer. Which of the following is a potent IV anesthetic and analgesic? Potent, okay, and IV. So option C is correct, ketamine. Ketamine is unique in its blockage of NMDA receptors, yielding both potent anesthetic as well as analgesic properties. Propofol is a potent anesthetic but weak analgesic. Benzodiazepine have little analgesic effect. It can be potent anesthetic at higher doses. Fentanyl is a potent analgesic. So there is only ketamine, which is both potent. Which local anesthetic is metabolized by plasma cholinesterase? This is very easy, tetracaine, because this is the only ester type of anesthetic of the choice. The other choices are amide type local anesthetic. They are metabolized by liver biotransformation. Always remember that esters will usually have one I in the spelling, where amide have two I in the spellings. Tetracaine has only one I, which is ester, and the rest have two I's, which are amides. This is just a A 23-year-old patient with a history of severe post-operative nausea and vomiting is coming in for plastic surgery. Now, which anesthetic drug would be best for maintenance in this situation? Now, among these, the correct option is propofol, because propofol infusion anesthetic would be the best with a history of post-operative nausea and vomiting, because propofol is the only anesthetic which has anti-emetic properties. Both fluorinated hydrocarbons, this isoflurane and sevoflurane, and nitrous oxide, they are linked to nausea vomiting during surgery. They does not treat. Next, a 61-year-old patient with an acute MI has severely reduced cardiac output. He has to undergo emergent coronary artery bypass surgery. Which of the following would you expect in this patient? Faster induction time, need for increased dosage, faster induction time with inhaled anesthetics, enhanced removal of inhaled anesthetics to peripheral tissues. Now you see here, in this case, option C, faster induction time, will be seen with inhaled anesthetics, because for inhaled anesthetics during low carbon monoxide during low cardiac output, a longer period of time permits a larger concentration of gas to dissolve in the slowly moving bloodstream. The large bolus of the drug has longer contact time to diffuse into neuronal tissue when it transfers the blood-brain barrier, yielding a faster induction time. The dose of an IV must be reduced. It should not be increased. Option B is totally wrong. With a reduced cardiac output, it takes a longer time for an IV induction drug to reach the brain. It will not give a faster induction time. And also, it is resulting in slow seizure. Next, a 70-year-old patient in the ICU needs sedation due to prolonged endotracheal intubation. Which of the following medication should be avoided for sedation in this patient? The patient needs endotracheal intubation. So, you see the option B, etomidate. It includes decreased plasma cortisol and aldosterone levels by inhibiting the 11B hydroxylase enzyme. Etomidate should not be infused for an extended time, because prolonged suppression of these hormones is dangerous. So option B is correct. All the other fentanyl, propofol and dexmedetomidine, these are safe for this patient for endotracheal intubation with. Now, a 35-year-old man presents with appendicitis and requires a surgical intervention. He has a family history of malignant hyperthermia. Which anesthetic agent is most appropriate to use in this patient? You see, among these, propofol is the only medication listed that is safe for malignant hyperthermia we have studied. All other fluorinated hydrocarbons, isoflurane, sevoflurane, desflurane, as well as succinylcholine, are contraindicated and they cause triggering actions. Flushing of the anesthesia machine, removal of vaporizers, use of special filters and availability of dantrolene are highly advised. Now, a 32-year-old woman presents for right distal radius fracture. She requests regional anesthesia to help with her pain post-operatively. She reports that as a child she had an allergic reaction to Novocaine, that is Procaine, at the dentist office. Now, which local anesthetic is appropriate for use in this patient? Procaine. Option. This Procaine is an ester local anesthetic, okay, for which she is allergic. It is an ester. Since the patient has an allergy, so other ester anesthetics, which are chloroprocaine, tetracaine, benzocaine, all these should not be used. Benzocaine is mostly used topically. So, ropivacaine, it is an amide. It is not an ester, which is used in the regional anesthesia to facilitate peripheral nerve blockade. So, option C, ropivacaine, is correct. Thank you.